Hello, everyone. This is Joseph Lucier here for our weekly Tongren session. For people that are not familiar, this is a healing modality for distance healing where we can open up blockages by sending intentional conscious energy. Distance healing, we are all connected by the heart of compassion in one way or another, and we are able to send this healing energy just as one would send compassion or prayer or other things. But let's begin. So we're going to start on our session right now. Esther is looking for work with osteoarthritis, left leg, bladder, left arm weakness, and nerve issues. So let's do our three-part process. Blood flow to the brain. Hello to happy mama and happy guest and curious guest. And Mumashari on Instagram. Blood flow to the brain, brain command points, sensory cortex, motor cortex, and Esther, any of those supplements that we talked about that you may have received that helped at all? And brain stem command points, circulation, inflammation, systemic enzymes, another idea. I'm sure we've talked about many, but we're going to continue. So blood flow and nerve flow to the spinal artery. C1 to C7. And also working with Catherine for the medulla, GV17. As well as C3, C4 for the eyes, blood flow to the eyes. Any of those new supplements that you have, Catherine, helping it all? Ouch point for the eyes for Catherine. Blood flow, nerve flow. So let's do it as a teaching, as we always do. T1 to T8, anti-inflammation, anti-pain. So, happy guests, that's less. Interleukin 8 from a blood test. Interleukin showing 2400. Let me make sure that I get this right. And let's get our definition complete, including the range. Okay. T1 to T8 for Esther, inflammation and pain. But let's really focus on the left arm and the left leg, so the brachial plexus. So let's get the information on that for the interleukins. Indication some kind of infection, which doesn't make sense for you. We need to look specifically, I think, at medications. And so the brachial plexus of the arms. Check if you've been exposed to the vaccine or a vaccine or somebody that has been vaccinated. Those are things that come to mind first. And left arm for Esther and left leg. And then the bladder, T7, blood flow and nerve flow, S1 to S5. And weakness, microbiome, T11, T12, L4, L5. And Catherine, T9, right side liver, also for the eyes. And grounding to liver 3 and kidney 1. So let's work directly with interleukins and the immune system. Blood flow to the brain. So that's also dealing with the blood, healthy blood for happy mama. Brain command points. Bone marrow, blood production, craniosacral fluid for all the ideas. Hello, Melinda from the land of Instagram. And you've been tested for COVID, I presume. For having such high interleukin 8. So just to be clear, I'm reading interleukin 8, a glycoprotein, which means sugar-protein combo produced primarily by macrophages, which are the great ones that eat up stuff and fix stuff. Its primary target cells are neutrophils. Interleukin is a chemotactic agent for monocytes and neutrophils. Chemoattractant cytokine produced by a variety of tissue and blood cells. So what is it chemo attracted to? So let's work on the bones. T1 for the bones. T1 to T8 for the immune system. So for all the bones, happy mama. And then we'll also work for Andy, who seems to be doing much better. So let's do craniosacral, the source. Oh, I'm just getting informed. So that scale of 0 to 66 is different than what I see. And we need further tests. But it's basically about inflammation. So if they couple that with all the inflammation markers, CRP, sed rate, homocysteine, B12, they can get a better picture. So craniosacral fluid system, the crystal palace, great word. T1 for the bones, sacrum 1 to 5 for the bones, and tailbone 1 to 4 for the bones. And tailbone 1 to 4 for the craniosacral circuit. So we work on the craniosacral fluid, T1 for the bones, GB39, also for the bones. And grounding to liver 3 and kidney 1. Send me any information you get, Les. I can review all of that for you. And again for Happy Mama. Hello, Tim. Great to see you, Tim. Great to talk to you. Blood flow to the brain. Command points of the brain. Command points of the brain, SEM. T1 for the bones, some more for Happy Mama, Mumushari, and Melinda, and everybody else, Tim Keys. T1 to T8, immune system, anti-inflammation. And microbiome. Also T7 for healthy blood, for Happy Mama as well. And we're going to do the lymph system, which is T3 for the lymph, T7 for the spleen and the lymph nodes, lymph of the neck, and grounding to liver 3 and kidney 1. And we will also work for Laura, happy gut. So blood flow to the brain and GB13, calm and worry-free mind. Let's spend some time on that for everyone. And then next for Andy, for prostate to the bone. So I see you, Dorothy, Marshall, and Deb, and everyone. So C1, C2, GB13, a worry-free mind, frontal lobe, top of the head, happy gut, T11, T12, happy hormones. A good herbal is ashwagandha, which is an adaptogenic balancing herb. T11, T12, L4, L5, and CV4 for the happy gut. Gut-brain axis, the communication link between the gut and the brain, GB12, vagus nerve, CV12. And grounding to liver 3 and kidney 1. Did Laura ever try the specialized castor oil packs for hormone balancing? That will help a lot. Okay. Everybody's doing great. So we have flowers, clouds, grateful humanoid. So the CBD helps the arm pain a bit for an hour or so, but that's it. Then the effect wears off. and Marie. Okay, everybody's here, which is great. So next we work for Deb and Heather for TBI, traumatic brain injury. So we work and focus on blood flow, 3 blood flows. Sky window, blood flow. Vertebral artery, blood flow. Like everybody's doing getting through the day by day. So 3 blood flows, occipital artery, TBI for Deb, TBI, traumatic brain injury for Heather. Yeah, and Tim, if you ever get time, interesting conversation we had, maybe some other things I'd like to ask you about. If you ever have a moment again, that would be great. GB 13, left side, right side for memory, mental confusion. Mental fatigue. So again, blood flow. Check your iron and copper levels. Head also has lots of concussions. So whenever I see nausea, I think of detoxing. The body's trying to get rid of stuff or purge stuff. So definitely some cleansing, colon cleansing or clay cleansing or clay therapies and castor oil therapies to basically cleanse the body. T1, 2, 3, 4, 7, 8, T1 to 8, anti-inflammation, nausea, teeth and receding gums, coconut pulling. Look it up, coconut pulling, coconut swishing, constantly refreshing your mouth, helping with the receding gums, a great tip. And then I use clay for my teeth, clay and charcoal for my teeth. And then definitely coconut pulling, maybe with a little bit of sesame oil for the gums and the teeth. And always teeth and gums, check your vitamin D. D is really important for your teeth and gums. GV20 for all the traumatic brain injuries. And next we work with Janet and Dorothy and Andy, who work right now. P1 for the bones. There's a great product called Grow Bone. Guarantees, basically has data anyway for greatly improving bone density, called Grow Bone 2-part kit. microbiome, T11, T12, L4, L5. And let me do one thing real quick. I'd like to be informed. Aplastic anemia, people with high levels of IL-6. Again, it is a bone marrow issue. Low cell production. Again, that theme, craniosacral flow, nerve flow, blood flow, oxygenation, the four pillars of healing, along with frequency medicine to help with all of these things. But those are the four main targets of everything. Continue with Ed. So it sounds like aplastic anemia is where there's a low production. Leukemia is where there is a broken production or broken cell result. So the cells are broken as opposed to aplastic, which is a cell deficiency. It's all about the bone marrow. And grounding. Timid mind, hello Joe and all, he says. But we don't want to miss Andy right now, so we work on the bones and then the prostate, T3, L3. So for any prostate or breast cancer, DIM product, hormone regulator, rectifier, DIM, a derivative of cruciferous vegetables for hormone balancing, aromatase correcting. L3 for the prostate, and the oxygen systems for leukemia and for arthritis and prostate issues. Phrenic nerve, sky window, the CV17 to the diaphragm. So we worked a lot on concussions. And work on one more area for the eyes, ears, nose, teeth, and gums. C3, 4, and 5. T1 to T8, anti-inflammation. C3, 4, and 5 also for the hearing loss, and GB789 for the vestibular cochlear nerves of the ears. And grounding to liver 3 and kidney 1. CV4 also for the prostate area. So fracture is hip is 90% better. So we're in great shape. Okay. So Dorothy Marshall, macular degeneration with both eyes plus cataracts. So don't forget that book, The Cataract Cure, and the eye cataract remedy, which is basically NAC for the eyes, for the cataract cure. There are also homeopathic eye drops for cataracts. Blood flow to the brain. So we work for gleeful guests and intrigued settler. Blood flow to the brain. And then pancreatic cancer for John. Command points of the brain. C3, C4 for the macular degeneration, blood flow to the eyes. Hawthornberry for blood health, heart health. Saffron for eye health, macular degeneration. And if you can find Dr. Tennant, reversing macular degeneration. With bioelectricity. He's the person who wrote the book Healing is Voltage. Let's work directly on the eyes, for both eyes. GV20 growth hormone, but GV20, the eyes, ouch point for Dorothy. And for gleeful guest, diverticulitis, T1 to T8, anti-inflammation, diverticulosis, and pterolisthesis on L4 and L5 and the heart. So let's begin with the heart area, T5, also for the aortic valve, CV17 for the aortic arch, and the heart valve stenosis, C5, AFib, the relaxator. Check out my program for the breathing program, which helps with AFib. I did it for myself and others. And anemia, check the unobvious. That's who I will be. I will be Captain Unobvious. Check your copper levels, because you may have plenty of iron, but the copper allows the iron to be available, as well as selenium. So we'll work on diverticulitis, osteoarthritis, which was T1, 2, 3, 4, 5, 6, 7, 8 for Tim. Diverticulitis, inflammation of the gut area, T11, T12, L4, L5. And there we go, L4 and L5 again. more with heart palpitations. Check your electrolytes, sodium, magnesium, potassium, and calcium. They manage heart speeding. Also increase your relaxation response. Breathing, the relaxator can fix that. No guarantees, I can say fix. But it helps a lot. So T8 for John. And we will be working with Augustina. We get tests coming up for Augustina, if I understand. And your mom will work on her too. So T1 for the bones, microbiome for absorption, T11, T12, craniosacral fluid for the bones, crystal palace to T1, sacrum 1 to 5, tailbone 1 to 4. That is also for the aplastic anemia, craniosacral fluid, bone marrow T1, sacrum 1 to 5, tailbone 1 to 4. And Jolly Specimen, you're right on time. So let's work for intrigued settler, heart palpitations, indigestion, eye floaters, and brainstem tumor for Augustina. Blood flow to the brain. And we'll work on both knees for Tim. Castor oil on the knees, turmeric with black pepper, fermented for anti-inflammation. Blood flow to the brain. 3 blood flows to the brain for the brain stem. And hello, Sundance. And hello, Sundance. How you been doing since your session? Hope you're doing much better. So for brainstem tumor, 3 blood supplies, sky window, carotid artery, vertebral artery, and occipital artery. Major focus on the brainstem GV17 and BL9. And for Martha, Mucuna pruriens, herbs. And we'll work on the brain area. Substantia nigra, part of the brain for the tremors. As well as the gut-brain axis for the migration of alpha-synuclein proteins from the gut, oftentimes due to constipation, up through the vagus nerve, GV12. And both knees ouch point, so T7 blood flow, nerve flow, lumbosacral plexus, and the ouch point for both knees for Tim Keys. And let me know about that course for Hannah Kroger, if you're going to go to that. and let me know where you are so I can refer people to you. People are looking for that service quite a bit. And finish for Augustina, brainstem, oxygen for anti-cancer, anti-tumor, and oxygen for clear breathing, phrenic nerve, and CV17, diaphragm, lung 1, lung 2 for breathing, for Sundance, lung 1, lung 2, lung 1, lung 2, Chinese point, CV17, phrenic nerve, T2, T3, bronchial areas, lung areas. And for Happy Moment and others, we're going to do a complete lymph tune-up as well. And grounding liver 3 and kidney 1. And let's work on some more clear breathing, clear mind. For Sundance, Rachel, blood flow to the brain. Another round of breathing. Lung 1, lung 2, phrenic nerve, CV17 for the diaphragm. Lung 2, lung 3, breathing. Laser on CV17 is a good option. And flowers, clouds, diagnosis, invasive breast cancer, right breast, T4, 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 left side, right side, both. DIM, hormone balancing for breast cancer and prostate cancer. Find an herbalist or a naturopath that uses mistletoe. Anyone with cancer listening to me right now, your levels should be about 120. That's the known beneficial amount of vitamin D levels for cancer patients that can help to reduce tumors. Megadose at first. Plant-based, of course. And let's work directly on the axillary lymph for the breast cancer. Grounding to liver 3 and kidney 1, but a little extra work, the mammary arteries of the neck to the breast and the ouch point areas, lung 1, lung 2, for oxygen and blood flow to the breast areas. So let me know about your bone scan as well. And grounding to liver 3. And of course, welcome to Angelic Lights. Always good to see you. So we do our 3-part process that covers everything: blood flow, nerve flow, oxygen systems, immune systems, craniosacral systems. That covers all of the interrelated support systems of the body, of course, including oxygen systems such as breathing and all those great things. So let's work right now with nice humanoid, Amy's gallbladder. So liver gallbladder cleanse sounds like a good recommendation for something like that. Definitely bring your fat intake to 5 to 10% max. Lots of apples or apple cider vinegar or malic acid directly in case there are stones, but the gallbladder and the bile production system of the liver and gallbladder seem to be possibly congested. Let's go to the brain. So, kind citizen, you did dietary changes in chiropractic for hiatal hernia. Yes, with a good chiropractor, they can solve a hiatal hernia. Or a good therapist. I learned from a chiropractor how to do it myself. It's a hand manual movement, which I did actually on a 95-year-old successfully. But I had good permission. It was my mom. So, blood flow, nerve flow. And eyesight for Faris. Faris's mom. I think that's Faris's mom, I'm guessing, or just intrigued friend, I should say. That's the right name. T10, gallbladder, bile ducts. So T9, T10, liver, gallbladder. In the meantime, eat loads and loads of fat digestive enzyme lipase to help support the gallbladder. Eat tons and tons of greens, bitter greens, to help support the liver. So T10, 11, and 12, gallbladder, bile duct. And for the eyesight, ouch points. And we have a comment. He must have super strong wrists by now. I do. I've done this about 84,364,000 times. But who's counting? Ouch point for the eyes, for eye issues, for everyone, including Catherine. Constipation, oxygenated, alkalizing, Tesla-based colon cleanse is what I recommend. It works. So you've got to add with her Amy's permission. What specifically? So C3 for the eyes, facial artery for the eyes, carotid artery for the eyes, ouch point for the eyes, liver for the eyes, C3 for the eyes. So we work on constipation, 3 parts, T11, T12 microbiome, L4, L5 for the microbiome, and lumbocervical plexus, L4, L5, S1, S2. And again, P8, John, pancreatic cancer, and J, colon area, P11, P12, L4, L5, L3, prostate, seminal vesicle area, sciatic left side, so we will be tapping for continued zonking. Okay, I'm all for it. And grounding to liver 3 and kidney 1. All right, Jolly Specimen, throat inflammation, harsh voice with a little bit of cough and mucus that seems to be going around, blood flow to the brain. Cough and mucus, GV 23, 24, special points. Mucus, things like cardamom is a great tea for phlegm called Phlegminade by a company called Jean's Greens. Right kidney, tumor, cancer, uterine fibroid, castor oil packs, big time, alternate liver, kidneys, and CV4 lower belly. And then high dose vitamin D. T1, 2, and 3 for the bronchial areas. T1 to 8 for inflammation and infection. And the oxygen system for kidney tumor, phrenic nerve, T6 for the oxygen, and kidneys, L1, L2. And uterine fibroid. Castor oil packs are like, that's one of the best things they do, uterine fibroids. What I would do is I would go to thefertilityshop.com. They have a uterine-specific castor oil pack with herbs. I think it's called thefertilityshop.com. Hethir, Hethir, maybe Rodriguez. She's the expert. She's the go-to. She has a very specific targeted uterine fibroid castor oil pack with herbs. We will also work in the area where you would work with the castor oil pack, CV4. And grounding to liver 3 and kidney 1. Yes, I have strong wrists and thumbs. My thumbs are also known as thunder thumbs. So, frequent hiccups. Let's work on that right away. T6 for the diaphragm. After severe diarrhea and took 2 pills of antidiuretic drugs. Hypotension when standing up. He had hypertension and diabetes for 20 years, but recently seemed to stop all the drugs. T1 to T8, anti-inflammation. Hypertension, GV17. Try to get some fermented beet juice, beet sauerkraut. Vasodilating, lung dilating, bronchodilating rather. GV17 for hypotension. T1 to T8, and especially T5 for the heart. T6 for the diaphragm. Yes, kind citizen, so you learned the hiatal hernia fix. I didn't learn it until later. The one that I do is you push in below the ribs, pull down, and a quick move to the right. Is that the one that you do? There are different ones. The other one is where you drink like a gallon of water and then come up off your ankles, boom, hit the floor, and it pops it back in as well. Do that with the guidance of a chiropractor, but that's another technique. Also working on T1 to T8 for mold toxicity. So I recommend two things as a foundational healing protocols: colon cleanse and clay detox program. That's for mold, viruses, bacteria, heavy metals mostly. So detox, T1 to T8, T3 for the lungs, and infection, lung and sinus infection, but especially C3 for the sinuses, and work on the area for the eyes, ears, and nose, ouch point for the sinuses as well. T1 to T8, and for deep despair, we'll work from our perspective. I would definitely boost up with your fermented foods to support the happy hormone production in the microbiome. T11, T12. Ribs, not the water. T1 to T12 for the ribs. And pain for post-shingles pain. Loose stools is a type of constipation. And you'll need muscle or weight gain because you're not absorbing. The food and the nutrients just rush through your colon. You need to clean the mucoid plaque. So I would suggest looking that up. A quick fix or a starting point is apple cider vinegar for mucoid plaque, as well as a good colon cleanse. Apple cider vinegar. T1 to T8 for shingles pain. Microbiome for the weight gain and loose stools. T11, T12, L4, L5. Also good for the emotional and psychological well-being. T11, T12, L4, L5 for confident soul. And GB13 right side for emotional and psychological well-being as well. GB20 for fatigue, hypothalamus, the endocrine system, mitochondria production. And we're tapping for the ears and for Indira from Nepal. I just bought something. I met somebody from Nepal and I bought something. I'll bring it next time. From Nepal. GB789 for clear hearing on both ears. For the vestibular cochlear nerve. Apple cider vinegar, take 1 to 2 ounces every morning, or mix it in water, 1 to 2 tablespoons, and drink it in 16 to 32 ounces of water. Probiotics, the best is from food, or Dr. O'Hara, who has a super concentrated, advanced fermented foods, probiotic. Sauerkraut, kimchi, natto. And we will tap for zonking. Balancing the thyroid, hypothalamus, and C6, C7. And grounding to liver 3 and kidney 1. And thank you everyone for joining. Liver 3 and kidney 1. All right, so let's do a little bit of chi. Everyone, breathe in through the nose. Out through the nose. Increase oxygen by 20% just by breathing through the nose. Charge the batteries, 3 main batteries. Third eye. Upper dantian, middle dantian, CD17. We can focus on GB13, emotional balance, ADHD. GB13 for executive dysfunction, hypersensitive. Lower dantian, CV4, also good for ADHD, emotional balance. The gut-brain axis. And grounding to liver 3 and kidney 1. And a little bit extra for emotional balance, GB13, right side and ADHD and executive dysfunction, GB13 left side and right side. And grounding microbiome for emotional balance, the 11D12, L4, L5 for jelly habitant. And grounding to liver 3 and kidney 1. Also good for psychological well-being. And fatigue, always check your copper iron levels. Basic deficiency of oxygen by way of a lack of deliverability by copper and ceruloplasmin. So, and let's clear the space for everyone. Thank you. I'm honored to be here for you. Thank you very much. Thank you, everyone. Be kind to one another. Focus on your healing, core fundamentals, oxygen, inflammation, toxicity, alkalinity, all of those things through myself or others, colon cleansing, detoxification, clay, castor oil packs, and of course, Tongren and compassion for everyone. Thanks very much and have a great day.